Hello, this is Dr. Lin. I'm the medical director of Milk Skin and Laser. We've been practicing since 2005, almost 20 years now. Yeah, Ellacor is a so-called microcoring. So the concept is derived from the puncture biopsy needle that we use in regular dermatology. The difference, though, is the size of the needle. Puncture biopsy needle tend to create a big wound and it will create scarring. But this microcoring technology, they use 27 millimeter needles in the array of 3 needles, and it was fired in a fractional pattern so that it will not create scarring, but it affords us to do puncture out of the microscopic skin substance in a treated area. It could be from the mid to low face, or off label we can do from the forehead all the way to the neck, or practically any target area of the body to reduce the extra skin. Since I have evolved from the beginning of this medical specialty, in the beginning it's a simple application of lasers in single modality to treat different skin conditions, and then eventually we realized we can do injectables like Botox or filler to reconstruct facial structure. And then since 2015, we also have a new concept how to combine different kind of lasers or even medication to improve skin health. So in medicine, we can always now can rebuild skin health or even rebuild the skin, the structure underneath the skin layer, but we can never have the ability to deal with the extra skin laxity. They tend to be in it's a more surgical procedure, have a more advantage over all the medical treatment. Yet certain area of face, for example, the loose skin or wrinkles around the mouth, or say the jaw lines, or say loose skin, except loose skin, right? Sometimes you cannot really ideally manage that medically or surgically. So microcoring, this concept kind of fit into the space that where there's no optimal management from medical surgical aspects. So it kind of fill in that need very nicely. I should mention that microcoring is actually a concept derived from the Dr. Anderson, which is the director of the world laser medicine at Harvard Medical School, but then also from the Department of Plastic Surgery of Harvard Medical School. They actually, in combination, come up with this idea and invent this machine. So I believe for the surgeons, they also see some unique advantage to their surgical procedures. I'll address the concerns that the extra skin, special skin lastly of certain anatomy, like around our mouth or the jaw line, right? Or even for the neck, if you're in the need to better manage the skin laxity, we can always improve skin structure by tightening, but we can never be able to physically do something about skin structure. Microcoring actually puncture our substance skin, so it promote physical shortening of the skin structure. It can reduce surface area of skin by 3 to 8%, depends on how we program the machine. So that also translates to shortening of skin by 1 to 3 centimeters. 1 to 3 inches of shortening of the skin on the treated area. Microcoring is physically subtract the skin substance from the structure. Microneedling just punches through skin structure, so it doesn't really take away any physical structure from the skin. So microneedling, the advantage more like induce the production of collagen and elastin, but there's no physical subtraction of the skin. As opposed to microcoring is a physical means of take over the substance skin structure. So there's a big difference in terms of the outcome. Microneedling is more original form of fractional device. In modern day, we already use a fractional CO2 laser by using the physical trauma and also on top of the energy from the laser to create a deeper wound and better outcome of producing elastin collagen. From the original study protocol, 3 treatments is recommended. Each treatment will somewhat accumulatively render the lifting effect. So 3 is more ideal endpoint. It will take about 6 months to see the clinical effect from the first treatment. So typically the recommendation is to perform this procedure in the intervals every 2 to 3 months for 3 times. Ellacor is actually is a procedure that need to have a skin pre-treated or structure be improved, right, before it can perform Ellacor to the most efficiency. From the development of this medical specialty since 2005, basically 2005 is the beginning of everything we now come to know. So I'm lucky to be in the evolution. So for me, right, I have developed skill to improve and correct structural deficits by using injectables such as Botox or Dysport or say Juvederm or Restylane kind of medications to improve structure. As a result, skin also become better because skin requires structure support to become smoother. So for us, laser in the beginning just deal with the single issues such as how to refine the skin or maybe take away blemish of skin. But in modern day, we actually combine the concept of how to improve structure and then do a combination of laser or say chemical peel all together to improve skin health. But we just cannot overcome certain issues such as skin elasticity. So Ellacor comes very nicely to fit in that point, right? Allow us to do physical means to remove the things we could never have achieved medically. So in that regard, right, we provide a better treatment for overall structural maintenance, also a skin maintenance, which are inseparable. To have a skin health restored to younger stage, it requires structural reconstruction, but it also need to cut off extra skin, right? So the Ellacor come to that place to enable us to achieve a very well-rounded approach of combining using energy such as laser or injectables and further time skin to achieve the non-surgical means of restoring our facial or a structure or other structure such as in the neck or any part of our body.